streaming, and I am going to switch over to the intro video, and now I'm going live from the mighty Veedverks Airship. This is gonna crack me up forever, but we're with Michelle Walker from MAMA. Is that how you say it? Mothers Advocating Medical Marijuana for Autism. And she's been one of the primary figures that has been involved with trying to add autism to the list, to Colorado's list of qualifying conditions for medical cannabis. And there was a vote last Thursday, I think, and it was pushed to this Wednesday. So all of the testimony for this vote was last week and this week tomorrow.
Well, and then the week, what was it, 2 weeks before that, right?
Was
when we
the
were all up there.
subcommittee.
Yeah, the subcommittee.
Right. And
Yes, our bill started in the House, and we did great in that vote. Excuse me, I have a little bit of feedback. I'm sorry about that.
I'm sorry.
So, we started in the House, and we went through our subcommittee a couple weeks ago. Huge response, amazing response from the legislators. We passed that committee 12-1, and then we passed the entire House 54-10. So we did have our hearing last week, like you said, in the Senate, and our vote is tomorrow. It is action only, and then hopefully we will be voted out of the Senate by the end of the week.
How do you, so you think it's going to go well? Like, do you think that this is going to pass?
Well, I'm ever the optimist. But I do. We have had great response from our legislators, but we do need some more push from the community with these members of this committee, the Public Health Committee in the Senate. We really need the public and your viewers to call and support and let them know that this bill is important not only to families like mine, but to all of Colorado.
So we'll hit you after this, and we'll post as a link onto the, onto this, like the contact information for. Is it the same characters as last time that we posted this, or?
Yes, both 1263 and 1286 are in the same committees, and in addition, the amendment to Jack's law is also being heard tomorrow. So our bills have gone together through this process. So I do ask that everyone supports both of these bills, because we can add autism as a qualifying condition, but our kids need their medicine at school.
That's right. So Jack's law is a law that Jack Split and Stacy Lynn spearheaded, that allowed kids to have access to their cannabis-based medicines at school. And Quentin's amendment to Jack's law, now that is coming up, is one that will allow school nurses to administer those meds to those kids. If you think about it, you've got a special needs kid, and you you've found that cannabis-based medicine, as many people who we know have found, is the best choice for their kids' ailments. And now, if we can just take it this next step so that school nurses are permitted to medicate kids with this cannabis-based medicine at school, then we're talking about parents starting to kind of get their lives back a little bit,
Right.
Being able to work jobs that, don't have 100% flexibility. So it's a big deal.
Well, isn't it not just school nurses, but anybody at the school can administer, like the assigned person,
It is. That's a great point. Anyone that the family and school feels appropriate, and of course it is permissible, so you do not have to participate. It is optional for school personnel. So my son's paraprofessional or his teacher could administer it, and actually my son's principal has already volunteered to administer it to him. This is really important to my yes.
Your principal.
Yes, we had an IEP meeting, and I just brought up the legislation in passing, and she offered. She said, "I want to do this. I want to save your son's life." And I'm like, "Okay." I didn't even ask. Right now, her office is the designated area which we give him his medicine at school. And I want to touch a little bit more on this because some legislators see this as a matter of convenience for parents, but it's more than just convenience. This is a matter of life and death for many. My son has severe autism and intractable epilepsy. So his medicine, his pharmaceutical that stops his seizures, or is supposed to, is anesthesia. I have 5 minutes to get to the school, administer this medicine, and if I do not, then they give him his pharmaceutical, which is anesthesia and can stop his heart and lungs. They have to call 911 immediately. So we constantly have to be 5 minutes away from the school. And we live our life in 5 minute increments. Can we go to the grocery store? Can I go to the Capitol? I have family support, and that's the only reason I can do this.
Can hear you.
Oh, they can't hear me?
No, try that.
All right.
Say that again.
I said, unless
Sorry, I'm
you
screwing
have,
with the microphone
yeah.
while we do this because that feedback loop I think you're getting from our microphone. And so
Probably.
while you were doing most of the talking, so
Anyway.
go ahead. It looks like it's
A
pretty
lot of parents don't, they don't
No, it's our
realize,
fault.
unless you have a special needs child, what you have to go through to get medicine. It's not just, unless you have that situation, you don't realize the hoops that have to go through. Not only do you have to have that prescription up there and it has to have the child's name on it and how to give it to it. Her child is on the same stuff my son was on, and they need to be calling 911 when they're administering it because, they only have a short period of time to save that child's life after that. So you're risking your child's life to save your child's life with the pharmaceutical.
Yeah.
So, but it's huge that your principal has stepped up. That's brave on her part. It's hugely brave on her part. She's gonna be. We need to send her something. Really being a trailblazer in the educational, because all of those nurses, they were fussing about, we don't want to give it to them, but in reality, they have 5,000 schools and only a nurse here on certain days, and the likelihood of it even being a nurse at all. Is just, but our cannabis medicine needs to be right next to the child's medicine that needs, what is it for bee stings, the EpiPen. It's a rescue med. In a rescue med closet.
Like little Canatol, nasal.
Well, that's what your son uses, right? Is the nasal?
Is that Jason? Is that Jason Cranford?
I don't know. Is it Jason Cranford's nasal?
Yeah.
It is Jason Cranford.
For those who don't know, Jason Cranford has a company that makes an organization that is well known for Haley's Hope and for Canatol, and I recommend them frequently.
Oh yeah, me too.
But it's been huge for our family.
Yeah. So right now, for like on your one pager, it talked, like in the first paragraph, it talks about how for like aggressive behavior, there are 2 drugs prescribed for aggression in autism spectrum disorders, and they're Risperdal and Abilify, and Risperdal, I think, causes like babies to grow man boobs for gynecomastia, something like that. But it's it's a big. Did you move here? I forget. Did you move to Colorado for cannabis, or were you here already?
No, I am a medical refugee. We moved here to access medical cannabis for our son. He does have epilepsy and autism, and we were out of options. We didn't know what else to do. So we came here, we tried all the drugs, we tried all the pharmaceuticals, and nothing worked. And this has just been life-changing for him. My son will be completely off pharmaceuticals by the end of the month, whereas he used to be on the FDA maximum. So it's just huge, the changes we've seen.
Aren't those pharmaceuticals, the ones my son was on, the biggest side effect was depression and suicidal tendencies.
Yeah.
It took every ounce of strength I had to go, here, my precious child, take a pill that's going to affect your mind and possibly make you suicidal.
Yeah.
That was terrifying, and sure. But you're so brave. Talk a little bit about the kids in the courtroom. One of our friends, Amy Dawn, she said, if you've met a kid with autism, you've met one child with autism. And that's true, because they all can be just a little bit different. But in that courtroom, we had a whole room full of very well-behaved autistic children. That was just... I used to have a special needs daycare. I have never seen a room full of that many well-behaved children, autistic or not.
Well, thank you. On behalf of myself and all of the families there, as you know, it was no easy feat. And some children did have meltdowns, and some had some self-injurious behaviors. But on my end, so all of our kids are different, and they are all affected differently. My son is aggressive, for instance. He's severe and limited verbally, but he would attack us. There are other children that may hurt themselves. So I think Amy Dawn really hit it on the head when she said that when you meet one person with autism, you've met one person with autism.
Yeah, that's a good way to put it. Mm-hmm. Yeah, sorry if we're having audio difficulties. We've not quite figured out
how to do this exactly.
Yeah, how to do this exactly. But are you getting bad feedback right now?
I am. I'm okay.
Okay.
Oh, it's a little better now. I just don't know how your viewers are hearing this.
Yeah, it looks like they're hearing it okay.
Mm-hmm.
Yeah. Oh, okay. They were great.
Yeah, no, I don't. I think that you're hearing something unique that, like I had to, I've had some weird experiences with trying to dial into other people's shows, and so I think that we're, but yeah, it does not appear that everybody else is hearing what weirdness you're hearing.
It's a lot better now, so
Okay.
I apologize if I seemed a little out of it.
No, I get it. I get it. I had myself on, I was like on a 90-second delay one time. It was the most confusing thing that has ever, happened with me so far. So I'm sorry for that. We're going to have to
No, it's...
figure out.
Thank you for having me.
Yeah, well, thanks for taking the time to come talk about House Bill 181263, which will be voted on tomorrow.
At what time? What time?
After adjournment, which is usually around 11, if you have anyone that is watching in the Denver area, I ask them to please just come to the hearing. I really want to hold these senators accountable. I want them to see our families. I want them to see the public and
Right.
see that there is a face behind this vote. It's not just a piece of legislation, it's our children's lives. And for many, it's a choice between life and death.
Right. Well, and it's such a no-brainer, because if epilepsy's already in, and we know children with autism, they have a tendency to have a higher threshold to have seizures, and many of them have epilepsy as well. It's just like that one family that one child didn't and one child did. So one child was a patient and one child wasn't.
Yep. You've got Google. You've got YouTube. It's without question that autism spectrum disorders are many of the symptoms of ASD can be helped with cannabis, and we know that it's safe. We know that it's not addictive. We know it's not a gateway drug, and
maybe a gateway out of gateway drugs.
yeah, it's an exit. It's an exit
Gateway
drug.
out of being trapped in pharmaceuticals.
Yep.
Mm-hmm.
Yep.
Oh, it absolutely
it's a
is.
way out.
It's a way out, and it's a way, like it's, I don't know. My heart's with the medical cannabis refugee community, and
Right.
it started. I think all of us know each other through Amy Dawn and American Medical Refugees,
Right.
and we, man, I'm fingers crossed. We've been winning. We've won a few things here recently, I think, in the movement, and I feel like we've got some traction here.
Well, we
So,
really do. You know, one of the big arguments that people will have is, oh, on the developing mind. You know, and I want to turn around and go, really? You know, let's talk about what Keppra does to a developing mind, Abilify does to a developing mind. Let's talk
Yeah.
about what it does to a developing
Yep.
liver.
Yep.
You know,
Yeah.
literally, and other
You know,
body organs.
Yep.
Just 2 or 3 days ago, the American Medical Association, the AMA, released a study showing that cannabis does not cause permanent brain damage in individuals.
Mhm.
It does not cause harm to the brain. So that is now a moot point. I don't feel like people can utilize that anymore. They can't use that as ammunition against us when there is an entity that they support stating that cannabis is safe. Isn't that enough?
Yeah.
How many more hoops do
I
we
know.
have to jump through to help our
I know.
Well, and these diseases cause inflammation in the brain. What does cannabis do? Decreases inflammation. So, you know, I'm kind of on that wavelength too, where I'm having a hard time, you
Yeah.
know, buying the old science.
I think this is the year. I
It
think
is.
this is the year, but we have to keep doing this. We have to just keep talking to ourselves and talking to those who we love and talking to those who may not want to be open to the message yet. But
Right.
But yeah, so
I found that a lot of people are touched by autism. It's in their life in one form or another, whether it's a loved one or a friend's child. So many legislators have approached me and told me their own story, and they see how this can help them. And there even have been a few that have said, hey, can you reach out to my family member and talk to them about this and tell them more? So this is no longer just a small issue. This affects everybody.
yeah.
Michelle, what's your home state?
Texas.
Ah,
Yeah. Whereabouts?
We moved from San Antonio.
I moved
Okay.
from San Antonio.
Oh, really?
Yeah, in 2014.
Small world.
Yes. Yeah. We need to fix some
didn't
stuff
know
in
that.
Texas.
yes.
I believe Veedverks products
do.
are available in Texas right now.
Oh, yeah, they are.
And
They should be.
perhaps even in San Antonio. But
There needs to be options for people in Texas,
they're due.
and Teacup is very exclusive, and even all epilepsy patients can't access it. So I appreciate you having options for those patients in Texas.
Not a problem.
We're fighting.
We're fighting. All the states. All of them.
Yeah,
Yeah.
we're fighting in all the states.
Including your home state in
Yes.
Louisiana.
Yeah.
Yes.
And we just had
Oklahoma. This
Oklahoma. We just read this morning that Oklahoma passed hemp, industrial hemp, which is a
Wow.
wow. And did you know that Kansas did it last week? So we've got Kansas and Oklahoma now are going to initiate where Colorado was in 2014. So they're 4 years behind, but we saw what happened in Colorado in 4 years. Wait till these farmers in Kansas are out there figuring out how to retrofit their combines to harvest hemp. Right? Like some big stuff's going to, like the Dust Bowl states, where we plowed up the prairie and like all of that farmland. So you know Nebraska's going to be quick to follow, and something big is changing as it relates to hemp, and as it hemp and what they call marijuana are part of the same plant, and by freeing that plant, we're just talking about percentages of this or that, and so
Well, it makes it less scary. It's our foot in the door.
It's our foot in the door, and they'll argue that. They'll say that, well, we don't want to. Hemp's just a foot in the door for marijuana. Like you damn right. You damn right it is. And guess what? Now it's legal in Kansas.
That's
Y'all
so
are 4 years behind, but I'm sure you'll do your best to catch up, and I welcome it.
I think they're catching on.
Yeah.
They're realizing that they're so far behind and they're missing out on so many opportunities, especially
Yeah.
in the hemp industry.
Yeah.
Well, just in the agricultural. Like in Louisiana, it's all cotton, sugar cane, and tree farming. Well, you can get a lot more out of hemp than you can with those three products.
Yep.
Yes,
All right.
Sure can.
Michelle, we're going to let you go. We're going to get off of this
Sounds
mighty Veedverks airship. But thank you very much for talking to us, and hopefully we've, spread the word to a couple more people. And thank you very much for taking a leadership role in trying to help a bunch of kids.
Thank you, and thank you to Colorado for giving us this opportunity and helping save my son's life. I appreciate you guys, and I appreciate everyone.
Yeah, cool. All right.
All right, bye.
All right, we're going to land this thing.
Bye.
All right, bye.
Bye. Well, that went well. You just have to figure out this audio.